So I'm in between cases right now, and I saw something that made me so angry this morning, and I'm going to tell you why. And I know that a lot of medical professionals follow me, and I hope that people who may consider doing this will not. So I was on Reddit this morning, and there was a post, and I'm not even going to tell you where it is because I don't want people to give this person more traffic, but an operating room nurse posted an intraoperative photo of a patient with Fournier's gangrene in the stirrups, about ready to have a vac replaced. So there was a large wound of the groin, perineum, and thighs. There was exposed genitalia, etc. And this particular board is known for kind of crazy extreme photos, and it's kind of has an educational tilt to it. And this wasn't it. So this nurse apparently took a photo of a patient in the operating room. And remember, operating room nurses are not involved in the patient's care other than in that moment in the procedure. There is zero chance she had consent from the patient or the family to do that. And then was posting it on a board on Reddit, not for educational content, but purely just to get likes. And then in the comments, people were asking questions like, how does this happen? And she literally said, in this case, probably from IV drug use. And obviously doesn't know anything about the patient, does not have permission to share this, and I'm enraged. So as a surgeon who's taking care of many, many neck fasc patients, both as a general surgeon and a plastic surgeon, this is a horrific problem. And these people trust us. They trust us with their lives in the operating room, and they're not fodder for social media. And I know that a lot of us medical professionals, we share content of photos in the operating room, photos of interesting problems, and we do it to educate and to explain to people how different processes work and what it looks like when you have these severe problems. This isn't it. Taking a photo as a looky-loo of something that you think is gross or extreme and then putting it on the internet for attention is so wrong. And frankly, it's assault. And I reported the post the second I saw it. I wrote like an angry 3-paragraph report to the mods in the group. But I would hope that any medical professional involved in patient care would never, ever do this. And I take photos of my patients who I'm the attending of record with permission all the time. And the purpose of those photos is to document things like if we're following a wound like this, or for educational content. And we always discuss with patients when we're doing things. But this is so not it. And I'm like still enraged. Like I want to find this person. I mean, there's been cases of people taking photos in the OR just of innocuous things and losing their license when they didn't have permission. Like this is so wrong. I'm just fuming about it.